Now, the concern for some doctors is what they're seeing in patients that have apparently recovered from COVID-19. While the virus is no longer in their system, some people are reporting to suffer from an array of conditions months after being discharged from hospital. And joining me now to give us some further insight about this is Dr. Itzik Levy, an expert in infectious diseases at the Sheba Medical Center in Tel Aviv. Dr. Levy, a pleasure to have you with us. So give us a bit more detail here. What kind of issues are patients presenting with after having recovered from the virus itself?
Thank you very much for hosting me. I tell you, it's really very interesting because it is all so new to us. Every day we are surprised from all the things that we see in the patients. Of course, in the patients that suffered from a severe lung infection, let's remember, this is first and of all a lung infection. They still continue to suffer from lung problems, from palpitations, from difficulty breathing. They have a very long rehabilitation period of regaining the forces, how to walk, how to talk, even sometimes how to sing without having those difficulties in breathing. In addition, many of them will suffer from neurocognitive problems. For example, difficulties in remembering, difficulties in concentration. Another part will suffer from peripheral neuropathy, which means they may have tingling or pain in their legs. Some of them, I saw also patients with what we call Guillain-Barré syndrome, which is a more severe kind of neurological problem. So really, we can see many things. One patient just told me that she suffers still, 3 months after she recovered, she virologically recovered, still have some problems with tasting and smelling, like everything tastes for her like chicken.
Wow.
Don't know if she likes it or not. So we see a lot of problems, and we are also now in the middle of a research. Like first, we want to follow up to see what's reversible and what is not.
Certainly. Now, but Dr. Levy, this is reportedly even in patients with very mild symptoms. So why are we seeing these kinds of conditions?
Actually, the most honest answer is that we don't know. We believe that some of this is a problem in the blood clotting. We know that the two main things of COVID infection are the inflammation, severe inflammation, cytokine storm, etc. And the second thing is this blood coagulation problems. And maybe sometimes, very small blood vessels are clotted, and then you see the damage. And as I said before, we still don't know how much of it is reversible and how much may stay with the patients for a long time.
Now, briefly, Dr. Levy, is this unique to coronavirus, though? Can one come to have further complications, both on a cognitive and psychological level, or rather physiological level, with other infectious diseases too?
Yeah, of course, we saw it before, with CMV, for example. CMV is a virus, one of the herpes family viruses. It causes you an acute infection, while most patients just recover and even don't know sometimes that they carry it. Many of them will still suffer from fatigue, from pains 6 months and even more after the infection. In HIV, we see neurocognitive signs and symptoms in patients. So it's not, something which is unique only to this virus. What is unique for this virus is that we don't know still the spectrum of symptoms that we will see. We just now started to see the recovered patients. We are starting to learn this new thing. And I think it's because we still don't know. We don't know what will happen in 5 or 10 years. It is so important to prevent all of this with this simple thing. Well, you can see it's, just wear it every place.
Absolutely. Well, that instruction is certainly being echoed by the authorities. So thank you so much for that insight and giving us something else to pay attention to and a reason to stay safe. Thank you, Dr. Levy.
Thank you very much.